Solen structure we can find, which is called tuber cinereum, and in which we get an opening which is called the infundibulum. Actually, this is the stalk of the pituitary gland. Pituitary gland is hanging from here, from here. So, tuber cinereum with infundibulum. Then we are getting two Solen structures. They are called the mammillary body. মাথাটা দিকে চলে আসে। আর তুমি অ্যাপ্রন না পরে কেন ক্লাসে ঢুকেছো? তাহলে অ্যাপ্রনটা পরছো না কেন? তুমি তাহলে ক্লাসের বাইরে চলে যাও। তোমরা যারা অ্যাপ্রন পরবে না, পড়তে চাও না যারা, তারা ক্লাসের বাইরে চলে যাও। আমি কিন্তু বার করে দেবো অ্যাপ্রন না পড়লে। হ্যাঁ, আমি কিন্তু এসব শুনি না। So this is the two swelling which is called the mammillary body, and behind the mammillary body we get this area, perforated area. If we see minutely here, we can see some perforations. These perforations, the perforated area is called posterior perforated substance, because here we are getting this artery which is called the posterior cerebral artery, which gives some central branches which pierces this area and goes inside. Central branches. Similarly, lateral to the optic tract, okay, an optic chiasma, we are getting this artery which is called the internal carotid artery. This internal carotid artery divides into medial cerebral and anterior cerebral artery. And here in this area we get another perforated substance which is called anterior perforated substance, where we can get the minute openings or perforations. They are caused by the central branches of this medial cerebral artery. This is internal carotid, divides into anterior cerebral and the medial cerebral. From this medial cerebral, we get the central branches enters through this area and create some perforations. So they are the anterior perforated substances. More laterally, we can get temporal pole of the temporal lobe. So this is the lozenge shaped area which is called the interpeduncular fossa, and all these structures which are present in this which we can detect in the interpeduncular fossa, they are just below the third ventricle. Actually, they are forming the floor of the third ventricle. Third ventricle is, where is the third ventricle? We know this is the third ventricle, and we are getting this area, that means mammillary body, optic tract, then we are getting tuber cinereum, infundibulum, this area. So they are in the floor of the third ventricle. Clear? They are within the floor of the third ventricle. Okay, so interpeduncular fossa, if you go just above the interpeduncular fossa, okay, then we can reach the third ventricle. What is third ventricle? There is one only single third ventricle in between two cerebral hemisphere, and it communicates with lateral ventricle on either side through the foramen of Monro. Then hypothalamic sulcus, then aqueduct of Sylvius, and we can reach the fourth ventricle. So, this is the third ventricle. This is the third ventricle. Okay. So, this interpeduncular fossa, the structures of the interpeduncular fossa, actually they are at the floor of the third ventricle. Here we will get most important content, that is the posterior cerebral artery, and from where we will get some communication. Okay. One, and there is a circle of artery, circle of arteries. Okay. Circle of arteries, which is called circle of Willis. Actually, that is not a circle, this is a pentagonal in structure. So, if in front it is, we will get the anterior cerebral artery. On these two anterior cerebral artery form, and there is anterior communicating artery. From the anterior cerebral artery on either side. এই দুটোর মধ্যে ছোট্ট কমিউনিকেটিং, অ্যান্টেরিয়র সেরিব্রাল এন্ড অ্যান্টেরিয়র কমিউনিকেটিং। এখানে এই বডিতে ছোট আছে কিন্তু অনেক বডিতে বড় দেখা যায়। সো অ্যান্টেরিয়র সেরিব্রাল এন্ড অ্যান্টেরিয়র কমিউনিকেটিং। Similarly, this is the internal carotid artery, from where one artery goes back, which is been torn. Okay, that is the posterior communicating artery, and this is the posterior cerebral artery. So ultimately we get an arterial circle, which is called circle of Willis. So it is formed by the anterior cerebral and anterior communicating, posterior communicating, and posterior cerebral. Okay, posterior cerebral, posterior cerebral artery. This is the posterior cerebral artery. So what is the content of the interpeduncular fossa? This circle of Willis. And here we get a lake of CSF, that is called cerebrospinal fluid. Actually, here there is a dural covering is there, and in between dura and arachnoid, subarachnoid space we will get, and we are get the subarachnoid cistern or lake, where we can find this we get the CSF in large amount. So this area is called the interpeduncular. This is the area. This is called interpeduncular fossa. So the cistern is called as interpeduncular cistern. Similarly, we can find cistern over the in front the pons, cisterna pontis. In between cerebellum and medulla oblongata, which is called cisterna cerebellomedullaris. Okay. Here we are getting the cistern, which is the interpeduncular cistern. Similarly, here at the just behind the splenium of the corpus callosum, here we can get we get the great cerebral vein, emergence of great cerebral vein, and this area is called, there we can get another cistern. Okay. Similarly, there are so many cisterns, and among them this is called the interpeduncular cistern, where we can get this circle of Willis. Okay. And circle of Willis is formed by the posterior cerebral and branches of the posterior cerebral, anterior cerebral, and from the internal carotid artery. Okay. Okay, it forms. So there is a communication between the carotid system and vertebrobasilar system of arteries. Actually, what is two vertebral arteries join here forms the basilar artery, and we can get a groove in the anterior aspect of the pons, which is called basilar groove. So, which lodges the basilar artery. This basilar artery actually divides into two posterior cerebral arteries. Okay. So, posterior cerebral arteries. Okay. Posteriorly. Anteriorly, we get the anterior cerebral artery. Okay. And this is the posterior cerebral artery. And in between, we get the middle cerebral. So, this anterior cerebral and middle cerebral, they are the branches from the internal carotid system. And this is coming from the vertebro-basilar system. From the vertebro, there were two vertebral arteries which forms the basilar artery. So, there is a communication between the carotid system of arteries and vertebro-basilar system of arteries. So, there is a circle of Willis. Okay. So, it is said that it is nature has provided this arterial circle, so that if one side is affected, the blood will come up from the other side, but it hardly replenishes that deficiency. Okay. So, here we can, what is clinical anatomy? Here sometimes we can find some berry aneurysm. What is berry aneurysm? Within the artery, there is ballooning of the wall. Ballooning of the wall. Okay. Ballooning of the wall of the arteries. And it is congenitally present. Okay. And when it ruptures, it can give rise to cerebral hemorrhage. So, you must have idea that this artery may have some berry aneurysm. Okay. So, this is the arterial circle which is called the Circle of Willis. And here we are getting also that lake of CSF, which is called cistern, lake, cistern or the lake of CSF. So, this you have to remember. So many, not much, that orbital surface, tentorial surface, this sulci, orbital sulcus, collateral sulcus, occipitotemporal sulcus. This is the most medially parahippocampal gyrus, part of the limbic system. Then medial and lateral occipitotemporal gyrus, orbital gyrus. This is the optic, olfactory bulb and olfactory tract, which we can find that it divides into medial and lateral stria. Okay, medial and lateral stria. It divides into medial and lateral component. Okay. So, this here the first order neuron ends, second order neuron starts, second order neuron ends at the uncus, from there third order neuron starts as the fimbria of the fornix. Okay. So, they are the part of the limbic system, they are part of the Papez circuit. Okay. We will be knowing. And here we are getting another, this uncus, and here we are getting one sulcus, just here, which is called rhinal sulcus, because this area is related, this uncus is related with the smell. What is the name? This is a nose. Rhinorrhea, that means, what is the meaning of rhinorrhea? That means water, running nose. So, this is for olfaction. So, this sulcus is called this sulcus which is present here. Okay, this is called rhinal sulcus caused by this uncus. Okay, clear? This is all about this inferior surface. Inferior surface or base of the brain is divided into two parts. One in front, that is the orbital surface, and this is the tentorial surface. And within the because it overlies the orbit. So this is the orbital surface. Orbit. And this overlies the tentorium cerebelli. Where we are getting, this is the cerebellum. Okay, so here fold of dura mater will enter, and which is called tentor, which looks like a tent. So it's called tentorium cerebelli, and this is a tentorial surface. Orbital surface has got some sulci, H-shaped sulcus. Okay, so this is called orbital sulcus. Okay. Okay, and it divides into several parts, or we can get the gyri. One is anterior, one is posterior, one is medial, one is lateral. Orbital gyri. Most and medially we can get another sulcus, which is olfactory sulcus, which is because of which lodges the olfactory bulb and olfactory tract. We know the olfactory nerve or the first cranial nerve. First cranial nerve passes through the cribriform plate of the ethmoid bone. In the base of the skull, we can find the ethmoid bone, and within the ethmoid bone there are several openings which are called cribriform, means net-like opening. Through those opening, actually the olfactory nerve rootlets comes, and first order neuron ends here. Second order neuron starts from here and ends in the uncus. This is uncus, and from the uncus the third order neuron starts as fimbria, and it is continued as fimbria of fornix. Okay, that is a part of the limbic system, and this uncus is concerned with the smell. Okay. Similarly, the tentorial surface. So this is the olfactory sulcus, and medial to it we can get one gyrus, which is called gyrus recti. Gyri recti. Gyri recti. This straight gyrus. Okay. Similarly, behind we can get one sulcus, most medially, that is the collateral sulcus. Then on the lateral side we are getting another sulcus. This is called occipito-temporal sulcus. From occipital to temporal region it is present, so occipito-temporal sulcus. So this collateral sulcus, medial to the collateral sulcus, this area, this is called the parahippocampus gyri. Parahippocampus gyri, and we can get two gyri on either side of this occipito-temporal sulcus, that is medial and lateral occipito-temporal gyri. Okay. Now about this area, we can get. I should comment on this area. Here we can find the optic nerves, the second cranial nerve, which the right and left joins and forms this flattened area. And from here, two tract originates, which is called optic tract. Okay. Similarly, behind we can get this area, which is called the crus cerebri. This is crus cerebri, this is another crus cerebri, which is more clearly seen in hemisection, crus cerebri. Okay. So, in front we are getting the optic chiasma, and anterolaterally we are getting the optic tract. Posterolaterally we are getting the crus cerebri, and most posteriorly we get the pons. Look, this is pons, this is medulla. Here we are getting the medullary, some pyramid and olive. These are the pyramid and olive, these are some parts of the medulla. So, behind we are getting the pons. So, this area is which is behind, in front by the optic chiasma, behind by the pons, anterolaterally by the optic chiasma, posterolaterally by the crus cerebri. This area is called interpeduncular fossa. Peduncle, cerebral peduncle. Okay. Actually, cerebral peduncle is a part of the midbrain. You can find this is the midbrain. Midbrain. Okay. Midbrain, pons, medulla. So, here you can find the cerebral peduncle. This is what is the tegmentum, this is the tectum of the midbrain, and this is the aqueduct of the Sylvius. This is the third ventricle. This is the entry to the lateral ventricle. So, what we can find? This is the area which is called interpeduncular fossa, and within the interpeduncular fossa we get some swollen area. This is called tuber cinereum, and here there is a stalk of the pituitary, which is called the infundibulum, from where the pituitary gland is hanging. So, tuber cinereum, infundibulum. Behind we are getting the mammillary body, and most behind we are getting this is perforated area. This is called posterior perforated substance. This is the posterior cerebral artery on either side. Okay. From here, the central branches enters through this area. Central branches of posterior cerebral artery enters, and this is caused the perforated area, which is called posterior perforated substance. Similarly, lateral to the optic chiasma, we can get this artery. This is internal carotid artery, which divides into medial cerebral and into anterior cerebral. So, this area is called anterior perforated substance because the medial cerebral artery, the central branches of the medial cerebral artery enters here through central branches enters through this area and cause an perforated area which is called anterior perforated substance. Okay, and within this area we can get posterior cerebral, anterior cerebral, internal carotid artery and anterior communicating artery. This anterior cerebral artery, they join with each other. This is called anterior communicating artery. Similarly, one artery comes out from the internal carotid artery, it goes back and joins with the posterior cerebral. So, ultimately we get a circle of artery which is called Circle of Willis. Here actually we get the dura mater. Dura mater is there and dural fold, and there is a space, the space between the dura and the arachnoid, which is called subarachnoid space, which is filled with CSF, and some area are very much voluminous. This area it is voluminous and it forms a lake of CSF, which is called cistern. Cistern means tank like, lake like. Okay. So, there are several cisterns, and this one of them is the cisterna interpeduncularis or interpeduncular cistern. So, here we will get the interpeduncular cistern and the content is the circle of the Willis. Similarly, we can get several cisterns, one in front of the pons, which is the cisterna pontis. One cistern is in between the medulla and the cerebellum, cisterna cerebromedullaris. Cisterna ambiens, from where we can get the great cerebral vein. Here this area is the cisterna ambiens. Okay. So this is the interpeduncular fossa and the content. And you can appreciate the structures of the interpeduncular fossa as just below the third ventricle. Okay. Actually, the structures forms the floor of the third ventricle. Okay. This is the floor of the third ventricle. This is the lateral ventricle. This is the communication. This is the foramen of Monro, and this is the hypothalamic sulcus, and this is the hypothalamus. This is thalamus. This is the midbrain, aqueduct of Sylvius, and from here the CSF will enter into fourth ventricle. So we can find this is the floor of the third ventricle, and within the floor of the third ventricle we are getting the optic chiasma, infundibulum. So here we can get the recess of the third ventricle, like optic recess, within the infundibulum, infundibular recess, behind pineal gland, pineal recess. There are several recesses. So just remember, this area is just below the third ventricle. And remember, this is the content in Circle of Willis. That much is about the base of the brain.